Hello there. So today I'm going to talk about long-term options for environmental allergy treatments for dogs and for cats. So your best option for most of these animals is actually to visit a veterinary dermatologist. So they can do something similar to scratch testing in humans where they kind of prick the skin with the allergens in the area, and whatever they react to, they make essentially like a vaccine or something to kind of teach the immune system not to overreact to it. The problem with that is it's expensive on the forefront, but if you really look at a young animal that's going to have allergies for their entire life, it ends up being cheaper to go to the dermatologist than it does to do the other options, but some people just can't put that money forward to visit the dermatologist. If that's not an option, there's a whole bunch of medications that can be used to long-term control allergy dogs. The big issue is they're expensive and you don't know which one's going to work until you try it. So not that long ago, maybe 10 years ago, most of our allergy dogs either got long-term steroids or they got long-term what's called cyclosporin or Atopica. Long-term steroids come with bukus of side effects. You can see animals that get diabetes, kidney failure, heart failure, Cushing's disease. It's not the safest thing in the world to do long-term steroids unless you have to. Long-term Atopica is used more in cats than it is in dogs. The problem is it tastes awful. They hate it, and it is heinously expensive. It's a fantastic product. It works really, really well if you get it in them. It's getting it in them that is the challenge. And more of our new age options, one is called Cytopoint. It is an injectable medication that the goal is for it to last 4 to 8 weeks. I've seen some work less, I've seen some work more. And I love Cytopoint. It does really good for the itching. In my personal opinion, it doesn't really do anything for inflammation associated with allergies, so that's kind of the downfall of it. But if you can catch them before they get super inflamed and infected, it's a great product. That's one that you kind of have to figure out their allergy season and how long it lasts and try to stay ahead of it. So for instance, if you have a dog that the Cytopoint injection normally lasts 5 weeks, maybe kind of reach for getting the next one at 4 weeks and 5 days so that you don't enter that itching inflammation phase before you get the next injection. Our other real option are going to be 2 tablets that are in the same family. One is called Apoquel and one is called Zenrelia. These 2 medications are anti-itch and they have a little bit of an anti-inflammatory effect, which is nice. The kind of downfalls of these medications is the pill only lasts for 24 hours, and realistically in a lot of dogs it only lasts like 20 of the 24 hours, so you still get some breakthrough itching. There are some reports that it can cause decreases of platelets, so occasional blood work is not a bad idea, and it has been shown that Apoquel and Zenrelia don't cause cancer, but if they already have cancer, taking these tablets can make that cancer grow faster. So you do have to have annual exams and kind of monitoring and whatnot. There's also a little flag with Zenrelia specifically that you're not supposed to give vaccines a month before or a month after administration. So I have a couple of patients on that, and when it comes to vaccine time, we give them a Cytopoint injection to try to get us that 8 weeks of not being on the medication. But it's not perfect by any means. All of those medications unfortunately do come with a significant price tag to them. Now, we don't have a medication like that in cats. That's why Atopica is so popular. There has been a little bit of research in using Apoquel off-label in cats, but since it is off-label, I'm not going to discuss it in these videos. So unfortunately, we kind of got to stick with what we got for cats. A lot of cats still end up getting intermittent steroid injections for their allergies just because they won't take the Atopica and they're miserable otherwise. Next, I'm going to talk about some of our other things that we can do for allergy pets that's not just the long-term stuff.